My name is Hadley Wesson, and I'm a general surgeon at Johns Hopkins Community Physicians at Howard County General Hospital. Soft tissue masses is a broad category where it can range from very benign masses that you feel on your skin, benign meaning that they're non-cancerous, to masses that are cancerous. And as such, it's important that when you find any of these masses that you're concerned about, to bring them up to your primary care doctor. And from there, your primary care doctor would recommend a surgical referral so that we can evaluate them. In terms of what causes them, if they're benign, they can be caused just from an overgrowth of benign tissue. Sometimes it's fatty tissue, sometimes it's a cyst. Or if it's cancerous, it can be caused by an actual underlying cancer. And anyone really can get them. Sometimes there's a genetic disposition, where if your parents had soft tissue masses, you may be more likely to get them, but oftentimes anyone can get them. Surgery is indicated primarily for two reasons. The first and foremost for you is that if you are bothered by the mass, if it's uncomfortable, if it's painful, that would be an indication to remove it. A second indication is if you're concerned about it and that we would want to look at the actual cells underneath the microscope and figure out what exactly this mass is. So, for example, if you've noticed that it's rapidly increased in size, if there's an ulceration, if it's changed in color recently, we'd want to remove it so that we could figure out what exactly it is. In terms of the type of surgery, it really does vary based on where the soft tissue mass is located, as well as how big it is and how deep within the skin it is. So it's very important during our first surgical consultation, when you meet the surgeon, to have a discussion based on what exactly the surgery will entail. If it's small and at the level of the skin, you may be able to go home the same day, versus if it's a little bit deeper or more extensive. These are all things to consider in terms of both planning the surgery and what the recovery is going to be. We also have to think about the reconstruction. If the mass is large enough, or if it's or based on its location on your body, we may work with our plastic surgery colleagues in terms of not only excising it, but also how we'd reconstruct it. In terms of whether or not the tissue mass will reoccur, really depends upon what type of mass it is. And the only way we'll know for sure is once we remove it and have our pathologists look under the microscope and figure out what exactly it is. Sometimes if it's a lipoma or even a sebaceous cyst, which are benign, non-cancerous soft tissue masses, they do have a tendency to reoccur. And that's why excising it in the first place in the operating room by a surgeon is key.